So Emma, tell us, the cases that we have currently, what's their status? Where are they being treated from? What do they look like?
All the 52 cases that are confirmed in the country are stable. They are currently receiving treatment at the Malago National Specialized Hospital, at Hoima Regional Referral Hospital, at the Jumani Regional Referral Hospital, and also at Grade B Entebbe. They are all in stable condition and we have not registered any deaths. Yes.
Many of these cases have already come into contact with other people. How far has the ministry gone in tracking down these people who come into contact with, and what's the handling of people to come?
So we have gone into an intensified process for contact tracing, and so far we have listed about 855 contacts as of yesterday to the confirmed cases. So we working throughout this period of the fortnight that was called mini lockdown. We intend to test all travelers who came from abroad between 7th and 22nd of March, and also reach out to all these contacts and test them such that we rule out the possibility of someone incubating this virus.
When besides the people who are in contact, we know that there are some who are in quarantine, and some of those quarantines have been reset. What's the ministry doing about the people in quarantine? Are they...
The people in quarantine, already the minister, Dr. Jane Luther Cheng, indicated they were being tested. So everyone who is under quarantine is being tested to establish their status as far as COVID-19 is concerned, and that process is ongoing. We've had a number discharged. On Sunday we had a total of 377 discharged from quarantine. So at centers where we have not had positive cases, the people who have completed their 14 days of quarantine are issued with a completion certificate of quarantine and also a test result slip showing they are negative of this this COVID-19. But we still counsel them through our psychosocial team, such that they are vigilant. In case of any symptoms, they can let us know, because someone can test negative today and tomorrow they develop symptoms. Because this virus being a new virus, really a test cannot really be a guarantee that you're okay. So there was also a debate that maybe they could do another period of self-isolation at home, and this is possible because everyone is supposed to stay at home. So even when you have been discharged from quarantine, you have to first really observe how maybe you're doing before you do much of interaction with your loved ones.
What's the criteria for testing? Do you have, say, these are the number of days this person has now been in quarantine, so you have support for testing?
You see, as the COVID pandemic has been evolving, new measures keep on cropping up, because now, for instance, people who have been in quarantine where positive cases have been confirmed have to do another days of another 14 days. That is a precautionary measure to ensure that maybe there was no contact during quarantine, because we got information some people would visit their friends in other rooms, much as we know there are people who have been strictly observing their quarantine. So our teams will continuously do an assessment. We have an advisory committee of scientists who advise the health ministry. So they will also continuously recommend, because they are the ones who suggested that people continuously shed this virus, and there must have been strict observance of quarantine before someone can be discharged. Yes, so the testing started just recently for all the people in quarantine, because previously we had the challenge with even the number of test kits available. But we have had donations coming from, for instance, the JACMA, so we now can at least test people who are in quarantine, and also contacts of the positives and contacts of those contacts. Yes.
My final question to you, as the pandemic plays out now, what should Ugandans look out for? The people who are staying at their homes in the lockdown, what's coming?
Our appeal to the Ugandans and any other person who is resident in Uganda is to observe the presidential directives. By observing the presidential directives that have been given, the guidelines by the Ministry of Health, the preventive measures, hand washing with soap or using a sanitizer, covering your mouth when you have flu or cough, such that you do not spread in your household, and also to alert us through our toll-free line if you have developed symptoms and signs. So this would enable us to reach out to you. So we are going to use this period to ensure that we do a thorough mop-up for the contacts, for all the travelers who have returned in the period I earlier mentioned about. So we hope if we are able to reach out each and every one of the listed travelers, because we are working with immigration, with civil aviation, to really get information and also the contacts of these people, and that information is available. The teams are now reaching out to them. So we appeal, when you're reached out to by the health teams wanting to pick a sample from you, be available, because this is for your best interest and also the loved ones. Yes.
Thank you so much.
Thank you for